Hello, my name is Lauren Bruce, and today I will be discussing a case study that has been done over one of my relatives. This relative's initials are KC, and she is a 33-year-old female. About 4 years ago, the patient had been experiencing some shoulder pain and some weakness in her arm. And after going to doctor after doctor, they finally diagnosed her with thoracic outlet syndrome. Thoracic outlet syndrome is a disease which symptoms include pain, tingling, or weakness in the shoulder and arm, and in some cases can cause numbness in the hands or fingers. And this can be caused from having an extra rib called a cervical rib that comes from your neck and into your rib area. This causes a compression on your nerves and blood vessels, which leads to the pain and numbness. As you can see, this is where your clavicle is, and this is the extra rib. And it compresses on the blood vessels and nerve endings, resulting in the pain. After going to the doctor prescribed physical therapy. She went to physical therapy for about a year and did not see any improvements. So after going to more doctors and specialists, she was ultimately prescribed surgery. In the surgery, they removed that extra rib, causing the compression and tightness to end. Before surgery, she was not able to lift her arm more than a 90-degree angle above her head without experiencing the pain or numbness in her arm. Thoracic outlet syndrome has four different types. The first one being the neurogenetic thoracic outlet syndrome. This is what the patient was diagnosed with. This happens in more than 90% of the cases. So this is the most common form of thoracic outlet syndrome. The next one is venous thoracic outlet syndrome. This is where only the veins are compressed, resulting in the lack of circulation in the veins. This type is in about 5% of cases. The next one is arterial thoracic outlet syndrome. This one is where only the artery is compressed, and this is in about 1% of all the cases for thoracic outlet syndrome. The final type is vascular thoracic outlet syndrome, which is pretty much a combination of the venous and the arterial thoracic outlet syndrome. Some of the causes from this are having a cervical rib, which is the extra rib coming from your neck, abnormal muscle or first rib formation. These abnormal formations can compress the nerves and blood vessels with their odd formations. Some other causes can be whiplash, bodybuilding, repeated overhead motions, and weight gain. Some of the ways that this disease can be treated is through physical therapy, a botulinum injection, which goes into the shoulder and pretty much just eases the pain, or surgery, which is where they go in and remove the extra rib. This patient ultimately had to have the surgery, but she did start out with physical therapy. She went to physical therapy for about a year and did not see any improvements in her mobility or her pain level. So after the year of physical therapy, she and her doctor decided that surgery was the best option. After her surgery, she restarted her physical therapy program and has seen an abundance of improvement. Her pain level has gone down, her mobility has increased, and she overall is just experiencing a lot more ease with her arm movement. She actually went to Disney with us about a year ago, and we made jokes because on all of the rides, when we tried to put our arms up, she could only, this is how she looked because she couldn't lift her arm. But now that she has had surgery, she can fully lift her arms, and in physical therapy, she is working on continuously increasing her range of motion, and her pain level is steadily decreasing. She had experienced many sleepless nights and many days just full of pain, but that is no longer the case for her. Thanks to physical therapy and her doctors, she now has a full range of motion and a much better outlook on life.